And I want to just introduce my friend, Randy Brockman, who's been so helpful through this pandemic. And Johnny on the Spot has provided us so many incredible programs. And I just want to say, like, we're coming up on a year now. It's a year.
I know, it's a year.
And I think we had like a bagel party like scheduled that week, I
We
believe.
did, and it was canceled.
Yeah, it was canceled. So
Postponed. It was postponed.
right. But we will eat bagels again together, I assure you. First, I have to lose the 30 pounds I gained during this pandemic.
Yes, exactly.
I'll treat myself to a bagel when I get there. All right. So if you just want to talk a little bit about Homewatch and your great services that you provide for our community, and then introduce our speaker today, because everybody is, we all really want to, have this conversation. Everybody's talking about it. Right. Everybody's talking about it.
And it's changing daily. It's so good that you happened to schedule me today, because it's a really important week.
It really is. It really is.
Absolutely. So I just first of all want to say that it's my pleasure to be back here again. I worked as a senior programmer for many years, and so I understand what Michelle was going through in March and even before. And so I love working with the senior population, and I enjoyed really working with Michelle and trying to find really good programs to engage you during this crazy time. So I'm from Homewatch Caregivers, as you can see, as is Karen. I'm one of the social workers in our organization, and Karen is one of our nurses. What I just want to say about Homewatch is that, especially in this time with COVID still around, home healthcare services are even more necessary than before, when some people were thinking about going into facilities, but keeping people in their own homes, their families felt more secure doing that, keeping people in their homes where they want to be and safe. So when a spouse or an elderly parent, a sibling or friend can no longer live on their own due to medical issues, dementia, or even the need for daily assistance and companionship, Homewatch is there to provide individualist care. When a loved one requires this type of care, the entire family is impacted. And we assign a social worker and a nurse dedicated to each one of our clients. So we get to know the specific needs of the person and the family, and we partner with them to ease the stress and responsibility at the time. And Homewatch is highly responsive and provides compassionate care through our 100 plus bonded, licensed, trained, and supervised home health aides. And we also do that not just for long-term care, but we also do short-term. So if somebody has knee replacement or shoulder surgery and their abilities are diminished for a short term, we can come in and help with mobility assistance, bathing, dressing, cooking, and other activities of daily living while that person needs it. And then when they no longer need it and life becomes more manageable, then we leave and the person goes on with their independent life. In January, Homewatch Caregivers received awards as a leader in excellence for the 7th consecutive year, as well as Best of Home Care Provider and Employer of Choice. So if you know someone who might need help caring for a loved one in their home or in a residential facility, Homewatch is your home health care agency of choice. And I'd be happy to answer any questions later on. But right now, we're going to have Karen speak to you about COVID, because it's here and we're dealing with it every day and things are changing. So Karen, take it away.
Thank you. I just wanted to add to what Randy said, that our caregivers we have 90 caregivers who have been fully vaccinated, which is outrageously successful in the world of home care. And we do on-site testing, COVID testing for them regularly, especially for those who are not yet vaccinated. They get tested every 2 weeks right in the Homewatch office. So we have taken this all very seriously since the beginning. But that's not why I'm here. I'm here to talk about Okay, we're getting our vaccines, and what's next? I mean, what does it really mean going forward? So of the people who I can see, how many of you have received 1 or 2 vaccines already? Wow, it looks like everybody. How many have received 2? Everybody. Great. All right, so this talk is really for you, and I don't have to talk about the part of what happens if you're unvaccinated still. So I don't know why this is, hold on one second, because I should not be getting any sound here. Okay. First of all, I want to start by acknowledging what we all know on this call. We never saw this coming. We never, ever knew a year and a month ago where we were headed. This is a total shock. Not only the idea of a global pandemic, because none of you are old enough to have been in the Spanish flu, I don't think. Maybe you were teeny babies, but this is unknown to us, and it's overwhelming. And I really want to give all of us permission to be kind of grief struck about this. It doesn't speak to our characters as deficient in some way to say this has really had an impact on me. And our moods have run the whole gamut in this whole year. Sometimes we probably feel quite okay and enjoy the quiet, and sometimes it's not at all okay, and we are suffering losses of seeing our family, our friends, of our old life. So whatever you're experiencing at any time, I want to start by saying, David, get that, please. I want to start by saying that be gentle with yourselves and your heart, because this has been a crazy time, and it's not you, it's it. So the other thing I think that's really important to know is that we have to find gratitude where we can. And one of the reasons to have gratitude right now is for that very question that I just asked all of you. You are doing everything you can do right now in order to stay as healthy as you can. And I want to take that premise that you've gotten your vaccines, that you're coming to a talk on, okay, I've had my vaccine, now what does it mean? That you're taking this time in order to find out how to continue to take the best care of yourself and your family that you can. And that's a really important thing. So how do we continue to take care of ourselves? First of all, we need to see what it's all based on. We each need our own understanding of how to keep well, not just following the rules. Following the rules is important, but I want to empower you guys to say, you know what, the CDC says this, but I'm going to be a little bit more careful, even than Dr. Fauci. That only comes to you if you really understand what we know. And what we know has changed. That's another hard thing. What the science behind it, we know more of everything, transmission, prevention, how it works. We know more than we did a month ago. So I'm here to talk with you about what we really know and what we don't yet quite know, and what it all means for you. So first of all, the CDC is a very, very fine place to get real facts, not opinions. And you can log on to the CDC website every day and get any updates that are there. That's a really good way to start with your own knowledge. I would stay away from a lot of the rumors, the videos. There are some ridiculous things out there that have come across my screen. And you have to look, of course, at what the source is. And if it's not the New York Times, the Washington Post, the CDC, don't listen to it, because there are some absurd things out there that I feel some people I know send it to me and say, well, what about this? And I say, where did you get this? This is drivel. It's not facts at all. So be careful. Be careful on the internet. Not all sources are equal. So what do we know now? If you let me take you back a year, and we'll just very briefly talk about what we thought at the beginning. We thought that coronavirus was spread just by droplets. And if somebody sneezed or coughed or sneezed on their hands and touched a surface, that was how it was spread. We know now that that is not the main way that it's spread. It's found not to be spread very much at all on surfaces. Doesn't mean we don't have to wash our hands. No, we still do. Doesn't mean that an unvaccinated person can take off their mask and go into an indoor space. No, it does not. So what does it mean? It means that the virus is in the air and mostly in closed spaces. Now, if you are fully vaccinated, the big news of this week is that we believe now that fully vaccinated people, that means 2 vaccines plus 2 weeks since the last vaccine. So you have to be both your shots, unless you're getting J&J shot, but you guys are already done, so I know that it's not the J&J shot. 2 shots and 2 weeks. And then you get to call yourself fully vaccinated. Here's the news flash, if you are fully vaccinated now, meaning the 2 weeks, and you have friends and family who are fully vaccinated also, we have now been given permission to be in an indoor space without our masks, including hugs. That is huge. It's the hugest change that has happened in this year. So let me repeat it. If you are, and only if you are fully vaccinated and your friends and family are fully vaccinated, then you may take off your masks when you are together and be in an indoor space. What doesn't that great proclamation include? It doesn't include people who are unvaccinated. You may not invite your friends over who are unvaccinated. You may not take off your mask if you are in any environment where they may be unvaccinated people. Now, why is that? You're vaccinated. What difference should it make? It makes a few differences. What we don't quite know, but they're tending toward an answer is, let's say I, fully vaccinated, go without a mask into somebody's house who is not vaccinated. Little do I know that they have the virus because they don't look sick to me. I breathe in their virus. Here's what we don't know. We don't know yet if, I know I'm not going to get sick. I have 95% chance of never knowing that I breathed in anybody's virus. 95% chance. So what if I breathe it in and then I go home to my family and take off my mask, and am I exposing my family to the virus that I picked up from an asymptomatic person? They think probably not. That's the good news. Right now, the scientists are saying, we think, Karen Frank, that your vaccine actually makes the virus you breathed in less potent, so that when you go home to your loving family, you won't give it to them, but we aren't sure. So I will not go into any situation without a mask where there might be somebody unvaccinated, or even worse, asymptomatic and giving off viral spread. Are there any questions about that? Because that is really the whole headline here, that we can be with other vaccinated people in an environment without our masks, but we may not be without our masks anywhere where we might be in the vicinity of someone who is unvaccinated and, God forbid, sick. So that's the whole thing.
So I have a question. So if you are vaccinated and you're not wearing your mask, and you potentially can pick up the virus from somebody, and you go home, will it affect both the vaccinated and non-vaccinated people in your home, or just the non-vaccinated people?
It may, not necessarily. They're really studying this so they can be definitive, and they're not definitive yet, but it's tending in the good direction. A vaccinated person who picks up the virus is possibly going to spread it to unvaccinated.
Unvaccinated. And that would likely be grandchildren or younger people, because they're not likely to be vaccinated.
That's right.
Mhm. Okay, thank you.
Or even our adult children,
Mhm.
who are not children, in fact, but in their 40s, they are not eligible yet, most of them.
Mhm.
So of my 4 children, I don't have any vaccinated children.
Okay.
But I have more good news as soon as Maria asks her question.
Well, I was going to be the whatever. I heard on the CDC them saying that vaccinated people can find a pod of unvaccinated people indoors, and that would be okay as well. So that
Thank you. That is exactly where I was heading as soon as you asked your question, but your question was where I was heading.
Okay.
Patricia, let's hear from you first, and then I'm going to unpack what Maria just said.
With the grandchildren, then, should we always wear our masks when we're in the presence of our grandchildren?
Okay, so the next point of the CDC is more good news for all of us. That is, if we want to designate another family, perhaps our grown children and their children, perhaps our next door neighbors, if we really know that this unvaccinated family is low risk, if you really have the sense, if you have a close relationship with them, and they're probably really going to be like your next door neighbor or your children, if we can talk to them about how they have been conducting themselves, meaning many of us have very, very responsible grown children, and many of us do not. Many of us have grandchildren who are in college, are going about their business as if they are invincible. So you've got to know who the other people are and how they've been leading their lives. If you feel that they are considered low risk for COVID because they're working out of home, or they're very careful, and they can assure you that their household is pretty safe. Yes, that is part of this new CDC unpacking. That it is now said you can also be unmasked with a small, select group of people who are unvaccinated. So be very careful who those people are. Because even if they're your good friends from across the street, but they have children who are less careful, more dangerous perhaps, you don't want to be unmasked with them. So yes, we want to get out of our masks, but we want to be really careful. Marilyn.
My grandchildren live with me,
Mm-hmm.
and they're 7 and 9.
Uh-huh.
They're not going to be vaccinated till next year.
Right.
I guess then I really shouldn't go out to a restaurant with my vaccinated friends and family.
No, you are fully vaccinated. Your grandchildren are asymptomatic. If you're going out with fully vaccinated people, you're fine.
But then when I come home, my grandkids should be okay?
Mm-hmm.
Okay.
Because you were out with fully vaccinated people. Now, let me just say as an aside, there are restaurants and there are restaurants.
Oh, yeah.
And that's where we have to be discerning.
Oh, yeah.
If we walk in and it looks too crowded, if
Yeah.
it looks, and we don't know whether those people sitting around us or if our waiter is vaccinated or not, I would still totally recommend, if you're going to a restaurant, to stay masked the whole time until you're actually eating.
Mhm.
And I would also be judicious about how often you're doing that.
Oh,
That's
yeah.
still
Yeah.
that's still a higher risk thing than sitting on somebody's deck, and warm weather is coming.
Yes.
Sitting on somebody's somebody's deck, and
I'm
eating
only
with them.
considering it because, I have some friends who are alone and going crazy.
Mm-hmm. Right.
But otherwise, I have no desire to go out.
Right.
we order and we bring it home.
Mm-hmm.
And that's good enough for me.
I think a lot of us, Marilyn, are being very conservative and taking baby steps. I don't see my own friends racing to have people over. So what are the constraints in this new CDC thing? One is that you still don't want to go into have large numbers of people at your house.
No
You don't want to have Easter Sunday, Passover Seder with your old 20 people, even if they're vaccinated. It's just too many. What you want to do is really choose, be selective. Small numbers, Dr. Fauci said. 6 fully vaccinated people, not 24 fully vaccinated people. We're not ready to jump back in. Baby steps is the safest way to do it. But there's a third change from the CDC that is great news. If you are fully vaccinated and you find out that your cousin has COVID who you had seen, you do not have to quarantine. You do not have to get tested. That you are fully vaccinated. That lets us know that the CDC really believes that that vaccination is going to keep us safe. However, Marilyn, because you go home to unvaccinated people, I would say in a case like that, possibly you would want to get tested just to be sure. So when do we get tested? About 5 to 9 days after an exposure. That is when to get tested. They believe that you will test negative. That will be great. But if it were my grandchildren and I knew I was exposed, I would get tested again. So we don't ever have to test in our normal lives unless we really know we were exposed, and then it's up to us to decide whether or not to. And we don't have to quarantine. So what's the biggest thing that didn't change that might make us sad? Anybody know? They still don't want us to travel at all. Yes, in the car, you can go in the car and travel to see your kids in Boston, but you can't go visit your kids in California. No air travel still. That is still considered high risk, and they're not giving fully vaccinated people the go ahead to do that yet. So just going back a minute, where are the changes? We can, fully vaccinated, be with other fully vaccinated only without masks, indoors. We can even choose a little tiny pod of people who are unvaccinated, but we believe that they lead careful lives. And it's a small group, and stick with the same group. You can't change your pod every day. You're choosing the same people. And we don't have to quarantine or test even if we think we've been exposed. Those are 3 big changes. Any other questions on that right now?
This is Jackie. I am being pressured into Easter together, but it would be with grandchildren, 26-year-old vaccinated, socially active travels, yes or no?
26-year-old socially active travels.
Vaccinated.
Vaccinated. Fully vaccinated, right?
Well, will be, but before by then, 2 weeks. Yeah, 2 weeks.
Okay. No, it seems safe to me. Fully vaccinated is fully vaccinated.
Okay.
You're fully vaccinated. That seems safe.
Okay. 23-year-old non-vaccinated, socially active travels.
Oh, non-vaccinated, you
That's a
said.
no, right?
Wait. You said.
Second
you,
one.
Oh,
No,
the second one.
second one, 23, non-vaccinated, socially active travels.
Okay. Here's where you can make some adjustments. You can go to Easter and wear a mask.
Mhm.
You can go to Easter, and if it's warm enough, have your gathering on the porch.
Okay.
You can, if it's not warm enough, open windows. All those things will help. You are fully vaccinated. That's the good news. However, they don't want us out of our masks with unvaccinated people.
Okay.
I think it's their way of also really encouraging everybody to get a vaccination.
Yes, I heard
Now
that.
there are really 2 tiers of people, and we're not supposed to mix that much.
Okay, I have another one for you. 20-year-old college student coming home for Easter.
I would say that college student absolutely has to wear a mask. I would say the 23-year-old unvaccinated has to wear a mask.
Okay.
And you can be in their presence and But I would mask anybody who might be carrying that virus. And that is, at this time, anybody who's unvaccinated.
Okay, thank you.
You know, better to be careful than be sick.
Yeah, absolutely, absolutely. But I'm getting some pressure, about doing a family Easter, and I'm not comfortable with it yet.
Yeah. Is there food? Of course there's food.
Yeah.
I would have them, I'd have the eating part very short and with windows open. And I would make sure that all the unvaccinated people are wearing masks.
Okay.
And you don't want it to be too crowded. How many people are you talking about all together here?
There are 10 of us.
At your house?
No, it would be at my son's house.
Good.
He's vaccinated. His wife will be fully because she's a teacher. The one grandson, but I just gave you the rundown. Yeah.
Yes. And I'm glad it's not your house, frankly.
What makes the difference?
Well, they're going to be indoors. They're going to be unmasked, at least for the food time. I would prefer, if it were me, not to have them breathing out in my airspace.
Mm-hmm. Okay.
Because
Thank you.
part of transmission also has to do with the amount of time spent in proximity. And if it's in your own house, I also wouldn't get in the car, frankly, with anybody who's unvaccinated.
Right. And are we talking? I'm so confused. I'm sorry. I don't know if anybody else out there is confused. I mean, you're not confusing me. All of this gobbledygook is just, I don't know. I'm finding it, I feel very annoyed right now by it all. Because there's so many contradictions, like from a week ago, like 2 weeks ago. And it's like, all of
They
this.
changed everything, Michelle. They did.
But we haven't changed. Like people were stupid before this. So why do we suddenly assume that people are going to use good judgment and like ask pointed questions like Jackie's asking? Like she's got it all laid out like a strategy here. But most people are just not even like hardly wearing masks to begin with. Oh, it's time to take off the mask. I'm sorry. But there's so many things I don't understand about this. But one is, are we just talking about the 5% risk for Jackie? Like, why not get in the car? She's fully vaccinated. So who are we worried about here? Her husband's vaccinated. She's vaccinated. You wouldn't be indoors with people. They're breathing their airspace, but you've been vaccinated. So I guess I don't understand what we're worried about. And secondly, my second question is, or comment is, air travel. Can we not require a card saying you're fully vaccinated? And then why not get in a tube with a bunch of other people that are fully vaccinated? Because if the stewardesses or the flight attendants are fully vaccinated, the captain's fully vaccinated, the people who clean the plane are fully vaccinated, and everybody on the plane's fully vaccinated that buys a ticket, I think, how is that any different, right, than what you're talking about?
Well, that kind of policy, leaving it up to the airlines to restrict travel to unvaccinated people, is a great idea for health, but in a place like the United States, it would never fly. I mean, all we need is to restrict people from flying when other people can, and unless they've positively tested. I mean, that's one of the things.
Right.
We can't make a policy that if you haven't been vaccinated, you can't get on a plane. We can do rapid testing, though, before they get on. And some places are doing more and more rapid testing before they let you in. And that is something that can happen, that airlines are requiring these rapid tests to get on.
In with a gun, right, or a bomb, can't do it.
Right.
Tested before, you go through metal detector, they take away your gun or your butane lighter or whatever. You can't go topless if you're a woman. There's certain standards, just like I don't understand people fighting about wearing a mask in a store. It's like you have to wear no shoes, no shirt, no service. you can't walk into into a restaurant with no top or no shoes on or partly clothed. Like you just can't.
Right.
Like, I just don't understand it. It's like, it's not, anyway.
But requiring a vaccine, I mean, we require school children to get vaccines, right? I mean, they can't go to school without it. So you're right.
You don't
The
have to.
airlines could, but they haven't, and they never will require people, only vaccinated people fly. That would just be impossible. Patricia.
Yeah, going back, and Michelle touched on the question. In Jackie's case now, are you concerned that she could be in the 5% and get reinfected? Or are you more concerned that she's going to be a transmitter?
I'm more concerned she'd be a transmitter, although I'm not hugely concerned because every day that passes, it seems that they are not finding cases. See, this is so new. That's why we don't know it. There aren't enough cases of people vaccinated. I think we have, I know the number, we have 19% now in the country of people who have received at least one vaccine. Once we get those numbers down, here's what's concerning still. If you look at the graph of new cases in the United States, and especially New Jersey is still bright red. So if you look at the number of daily new cases, it is still being transmitted too high. Once we get back down, even where we were last summer, if you look at the graph, last summer looks like Eden. You know, we really were in good shape in the summer. We're not in that good shape right now. However, the deaths are really down, which is interesting because it doesn't mean that we have fewer active cases at all. What it means is we're much better at treating, that there is treatment now. They've learned a lot about how not to treat people that they used to think putting people on a respirator right away was a great idea. They found that wasn't a good idea, that there are other good ideas. They have monoclonal antibody treatment. So you get a blood infusion from people who have actually recovered from COVID. That's been a very good treatment. Nobody's ingesting bleach, which is very good that nobody seems to be dying of bleach ingestion. So we are better at treating, and the deaths are way down. I gave this very same talk, only everything I said was different. I think about a month ago, maybe 3 weeks ago. And what I wrote down then is our daily death rate in the United States is still 3,000 a day. I checked today, 3 weeks later, our daily death rate is still something, it's still 1,600, but it's half of what it was 3 weeks ago. So there are real changes here, people. Now, the thing that didn't move enough is our positivity rate was over 9 3 weeks ago when I gave this talk, and now it's only 7. 7 is still too high. They want our positivity rate to be below 5, like it was in the summer. So below 5 is where we need to be. And what else is much better is the infection rate. All right, so what's the difference between infection rate and positivity rate? Do you care or not? I'll just tell you, the infection rate is 1, which is pretty good. It's considered fair. So we're out of the red zone in New Jersey in a number of ways, but not with new cases. New cases are really still red. We don't want to be red. So that's why I am being more careful, Jackie. And it's not because I'm worried about Jackie's health. It's because I am worried about transmission rates. I think Jackie's healthy. And I don't think, even that 5% of the 95 that goes with the 95, so far, there hasn't been anybody who's gotten very sick who has been fully vaccinated. Against very sick, it seems to be 100%. That's amazing. There isn't a vaccine, I don't think, that has such a high rate as that. So that's great, and we can celebrate that. So I'm not worried about Jackie. I'm worried about Jackie as transmitter, because we're trying so hard to get that rate down so that we can take our masks off on the beach. That's my goal.
I want to add something that Jackie mentioned, and that is the pressure. And I think at the beginning of your talk, Karen, you said that we've all gone through some kind of transference of some kind of change during this time. And I think that one of the most important things is that we have to have respect for people's comfort or discomfort level, and be sensitive to what that is. People in the same family are not feeling the same way. Some people are feeling that they can handle more, that they can go out there and they can do more. And some people are just more hesitant. And I think that we have to respect both, even in the same family. So I think, Jackie, if you are feeling that way, you have to share that with your family. I'm not ready. I'm ready for 6 people. I'm not ready for 20 people, that they have to respect that too. Or I'm ready to be with you, but I need for you to wear a mask. I think that would be an important conversation to have amongst your family members.
Right, I agree.
Mm-hmm.
That's why I wanted so much to participate in this talk today, so I would have some facts to be able to discuss with them.
Mm-hmm. The CDC has listed on their website these new regulations very succinctly. Actually, Randy, is it possible for you to email the document that Homewatch made with the guidelines? What can I do after I'm fully vaccinated? That came from Homewatch and went out to our people. I'm wondering if you can email that to Michelle.
Yeah, sure.
Who could email it to this group, because they're very succinctly listed what you can do after a vaccine.
Yeah, I'd
It's
be happy
just a number of bullets.
Good, thank you.
Okay. Randy, I think what you said is really, really important for each of us. When I say baby steps, and it's better to be more conservative now than to be risky, we can always open it up more. We're tired of this. There is really COVID fatigue. However, the good news is it's really going to be spring, and we will be safer just for being outside more and for just having our windows open. And we can always put on our masks, even though we're fully vaccinated and we've been given permission not to with other people who are fully vaccinated. But if you're just not sure, if you've got somebody in your family, as Randy pointed out, none of our families are all doing exactly the same thing. We can put on our masks.
And I think we can also ask them would you get, if you have this 20-year-old who's coming home from college, would you please go get tested 2 days before our Easter gathering?
Mm-hmm.
It would make your grandmother feel much more secure.
College kids do get tested weekly, and they can get tested daily if they choose to. So the
Perfect.
college grandson would be tested right before he came home.
But your 23-year-old can do that too. There are tests around. It's not like 6 months ago, 9 months ago, where we couldn't get people tested. And if that would make you feel more secure, I think you could share that with them and say, I want to be with you, but it would make me feel better.
Yep.
Great point.
We had a funny situation yesterday. We were picking up the grandchildren because we're fully vaccinated now. We were going to bring them over to our house. And my daughter's sister-in-law showed up and she said, oh, I don't have a mask. And she said, but I'm vaccinated. And I said, well, so are we. And I think that's okay because we're all vaccinated now. So we didn't know what to do. It was like, oh, but we didn't hug. We didn't get any closer than 6 feet. We still felt, okay, we don't know. So we're still going to treat it a little bit with a little bit of space, but not worrying so much about, because we were all vaccinated. Don't throw the mask on. It was kind of awkward, but funny.
Also, we have to ask people when they say they're vaccinated. We have to feel comfortable saying, did you get both? And was it at least 2 weeks ago? Because 19% of the country is vaccinated, but only 7% is fully vaccinated. So that means, people use the term differently. Oh yeah, I'm vaccinated. I'm going for my second shot in 3 weeks. You know what? You're not vaccinated. Any other questions or concerns here? Do you feel you've pretty much understand what these guidelines are and what you can do differently this week than last?
I am not fully vaccinated. I haven't gotten my second shot. Everyone I've spoken to who got the second shot has had reactions from severe to mild. Is there any way we can avoid that? Yes,
I'm so glad you asked. First of all, not everybody gets a reaction at all. I frankly didn't at all. Nothing happened. I'm in the minority. I know it. I just happened to be lucky. There was nothing I did. Here are some of the things you can do. Do not, before the vaccination, take pain relievers. Do not take Tylenol and ibuprofen, anything before you go. I know a lot of people thought that would be a good idea because then they wouldn't have symptoms. But it's not a good idea because it makes the vaccine less effective. So one of the things you should do when you get your vaccine is you should keep your arm moving for those 15 minutes that you have to sit in the site to make sure you don't have side effects. Keep your arm moving. That really decreases the soreness that's possible in the arm. Second thing, the soreness in the arm, which most people get, is not bad. Your arm is sore, but it's not dangerous and it's uncomfortable. You might not be able to sleep on that side. And if your arm gets sore, like later in the day, you can take Tylenol if you need it. So taking Tylenol after your vaccine, if you need it, is fine. You don't want to take it beforehand. Something else you can do is drink a lot of water before you go. It's better to be fully hydrated than not. Watch yourself for fever after. Most people do not get fever, but some do. If you get fever, take some Tylenol. They're saying that some people after the second one feel nauseous. What are some other newer things? Some people get muscle aches, and a lot of people get tired. So those are kind of the normal reactions that a number of people say. Most people, however, do not get it severely. Every now and again, somebody does. And unfortunately, they talk a lot about it. And so it seems like more people than not do. But the truth is, I mean, as I told you, we just vaccinated over 80 people at Homewatch, and a handful of our 80 people had reactions enough that they didn't want to go to work the next day. That was it, a handful. So, you know, clear your calendar the next day and baby yourself a little bit, but you're not gonna, it's not dangerous. Yes, Angie.
I wanted to ask about going to a doctor's office for a visit or for a test. They, like I went for a doctor's visit for cardiology and they asked me if I have been tested. So they required for me to be tested. And then the colonoscopy also the same thing. But it didn't dawn on me to ask them, how about you? Have you had a test done? I mean, they ask all the patients, but how about the doctors and the receptionists who greets you in the office? Would it be valid for me to question them if I am scheduled to go to the office?
You can certainly ask. I would assure you that probably they are, but go ahead and ask because you need to feel comfortable.
Right.
And now, as Randy said, testing is not the same as it was a month ago. There are tests, many, many more places to get tested. I went yesterday to an assisted living to visit somebody and they tested me before I got in. I thought that was very responsible of them.
Yeah. Mhm.
I mean, I really was already tested, but I didn't, and fully vaccinated, but they still tested me.
Yeah.
And I didn't say, how dare you? I said, thank you for keeping your residents safe.
That's good.
Anything else? Yes.
Yeah, back to Jackie.
Oh, no.
If Jackie goes, our example, hi Jackie, if Jackie goes to her son's, she's with unvaccinated, non-socially distant grandkids, but say, okay, potentially she has gotten infected, but she's not going to show it. How long should she kind of be concerned about spreading it? A week, 10 to 14 days? I know they say in the past you had a quarantine for 14 days.
I don't think Jackie has to worry really because she's going to ask them to be masked. She's going to, she's not going to be hugging and kissing unvaccinated people. I think she's okay. I don't think there's enough in that picture to say she has to be careful. And remember that third point from the CDC, even if she learns that she was exposed, they're not recommending quarantine for Jackie or even testing.
No, but you had said she could possibly be a spreader.
She could possibly, but apparently it is not so likely that the CDC feels they need to quarantine or test her. Okay. So it's really until we get to what they call herd immunity. You know, herd immunity is when enough of the population is vaccinated and therefore we can consider a population pretty safe. When we get there, which is about 75 to 80% of vaccinations instead of 19 or instead of 7, I think that the Johnson & Johnson will really help with that because I think there are a lot of people who don't want 2 shots. It feels daunting, so they're waiting. I think even though the Johnson & Johnson isn't quite as effective, at least in this testing, as the Moderna or the Pfizer, it still is enough to be considered appropriate to get us to herd immunity. Once that happens, probably this summer, we'll see the next major change in the recommendations out of the CDC. Maybe even masks off, but we're not there yet.
Aaron, now that I saw Patty, it reminds me, what about 4 fully vaccinated people playing Mahjong outdoors?
4 fully vaccinated people playing Mahjong indoors without masks is okay.
Oh,
Go
there-
for it, ladies.
Okay.
Michelle,
Michelle, that,
Even indoors, even eating, even sitting around a little Mahjong table. Yes,
oh, wow. Okay.
go for it.
So that's why I got my first shot, because you know, I want to be able to open when we can. But the thing is, it's going to be, you know, there's a whole liability issue. I think that, you know, we have to contend, because how do we, you know, how do you show proof? How do you, I mean, you have to trust people that you're, you know, obviously.
No, you get the card. You get the card.
Right, but how, there's HIPAA laws, like, I don't know what that looks like from our end. You know, like, you have to sign a waiver. You know, township doesn't require employees get vaccinated. You know, what does that look like? You know, so there's a whole litany of issues that we have to deal with. I'm fully prepared to deal with them. But, you know, the direct is not going to, you know, it's not going to be my decision.
Right.
So, you know, it's not as simple as that from my end,
Right.
as much as I would like it to be, which is why I went ahead and kind of nudged along a little bit. You know, I don't think that there would be a problem at all with setting tables up outside when the weather's nicer. Before we get to that point with liability and cards and waivers, I think, you know, I could see that for sure.
Many of the sites are actually laminating their cards in order to allow for people to carry them, because the anticipation is places may be requiring, you know, if you want to go to the gym, you have to show that you've taken your vaccines. So those cards are designed to be shown if necessary. Anything else? You know, I'm sorry for the confusion, but it's not simple. It's not black and white. You know, Jackie, you have all the stories in your house. and it's not, you know, if only we could say, yes, this is the way it is. But it's changing, as you know, all the time. And some of it is just making the best decisions we can. As Randy pointed out, it is emotional because we've got family members involved and people with different beliefs. It's complicated, but I think that the 3 things that just changed for the positive for us from the CDC this week really is the first big step forward. So we still want to wear our mask in the grocery store. We still want to wash our hands every time we come in the house. We still want to wear our masks when we are going to a restaurant, except when we're eating, of course. We want to wear our masks when we can and when we don't know who's around us. But when we're inside with small groups of friends who are fully vaccinated, it will be wonderful to take our masks off. And when we think we've been exposed and we don't have to quarantine, that's amazing. And to be with our unvaccinated little pod without masks is huge. So we've gotten 3 very big gifts, I think. and there are more to come. And we can take these presents we've been granted by the CDC, be grateful, know that we're moving in the right direction. The death rate is down 35%. We were moving in the right direction. And it's really that transmission rate that we still have to be concerned with. And we do that with wearing masks ourselves, even fully vaccinated. And Camille, is she still here? I hope you get your second shot. Yes.
I'd also like the email address for the CDC.
Just, I don't have an email for them, but it's cdc.gov, I think, is the website.
But I'll also send, Randy sent me that sheet. I'll send it to everybody that was on the call today.
Great.
Yeah, that'd be great. Thank
Thank
you.
you. Thank you.
All right. That's what I've got today.
Thank you so much, Karen. We really appreciate it.
Thank you.
Thanks, Randy.
Thank
Thanks,
you.